And you must understand, if we can explain to the parents, this is why your child escapes in a dream world. And I mean, because the allopathic approach, I don't know if you know about the floor technique, you know, the floor time, which is basically trying to get on the same page with the child, no matter where the child is. If the child can only do this, the adult, the mother, father, must try to get on the same page so they can engage, even if it's small engagement to the child, the beginning, you know, of engagement, because the lack of engagement is one of those crucial symptoms. Well, you can imagine if we can explain, and we can, once we find the remedy, if we can explain, but this is why your child is escaping in this dream world. And don't do this, because that also give you an idea. Let's just say the child escapes in the dream world because the child feels that it's all alone in the world, and it's afraid of the world. As we call it sometimes, you know, all alone in the wilderness. Okay, all bad animals, we don't want to get there. No, what I'm just saying now are absolutely clinical examples, right straight from my clinic. I don't have to look very far. Because I had once a mother who said to me, well, whenever I get fed up with my child, which sometimes is very understandable, I tell my child, if you're not going to behave, I'm going to put you out of the house with the big bad wolf. Now, unfortunately, the child's remedy was stramonium, which has the core delusion, all alone in the wilderness. So, you know, you can imagine when this is be done to that child, what is the child going to do? Even more. Okay, it's going to react even violently, and even more will withdraw, right? So it's basically what the mother did unconsciously, obviously, is playing into what really ails that particular person the most. What's the biggest fear, and that's accentuated. So you see, we can explain, this is not, don't do this. Although even psychologically we could say, don't do this. But especially for this particular case, because it was really the child's, you know, we call core delusion, cyber delusion, primary delusion, name it, there's many names for it. Really coined very well by Carl Jung, which is where I got all my studies from when it came to core delusion, primary delusion, he called it, archaic, primitive, cyber delusion. So it is very good for us that we can say to the parent, this is why your child is doing. So now you can understand too. If they understand that, it's much easier to get engaged with the child because they get on the same page, right? They know exactly why is this child doing it, so they can really help the child. Unfortunately, the child, when they go to school, there is the other danger, of course, right? Because here, I can tell you too many stories. Homeschooling, therefore, is really, with a lot of these children, I probably say very favorable, because you have more of a controlled environment. But otherwise, the child, you know, once you leave the child at school, it's hard for the teachers, first of all, to deal with all this. They are not really trained for this. Even if they are trained for special educated child, you know, special need children, still, you know, how many, just like anything else, how many good professionals do we have? It's like in any profession. And not only that, then the danger, if they are in a mainstream school or there is another, how they get actually abused, you know, by other children. I can tell you many, many examples. So you see the difficulty for us too in the homeopathy, that too many things can happen to these children and we don't have any idea about it, that it did happen. I mean, the child can be hit. I mean, I have so many examples, very cruel. I mean, even one story I remember was even on TV, not my child, not, you know, one of my patients, but, you know, they had an autistic child and the teacher got fed up with the child, locked it up in a room, and then forgot about the child. And the child was locked up for 4 or 5 hours. You can imagine the trauma. What is the reaction? It had nothing to do with our remedy, you know. It had to do with what happened, unfortunately, to this child. So it is a very hard management in that way. It's not easy. Often, as I said before, both parents are not even on the same page. Often, the father doesn't really want to deal with it. I hear it too many times that it comes all down to the mother, who are very dedicated, most of them, but at the same time, they get overwhelmed. Now, they need a remedy themselves, and before you know it, because they the mother that is overwhelmed. They're going to think they lose patience, and they think the child needs another dose of the remedy. Well, the child doesn't need anything. They need a remedy. See, so it is very difficult in that sense, more difficult than other children, whatever it is, be it an asthma case, an eczema case, just name it, anything. No, I mean, that becomes easy in comparison with a child with autism.
You mentioned earlier that you're working on a book specific to autism at the moment.
Yes.
I wonder what type of content, what tools are in there that would help a homeopath with these?
Well, when I wrote the book, or I'm writing the book right now, it's going to take me probably another year. My first aim for the book was definitely to do it for the parents. Things that I discussed now, because I see where the problems are, you know, the many questions parents have. Certainly, I mean, I thought about writing 2 books at the same time. So an additional book for the homeopaths versus the book. But I think the way I'm doing it now, it's actually for both. In other words, I can give, I would say, ammunition to both, you know, really help aids for both, just the parents as well as the homeopath. Even with the studies, like I said, the allopathic studies that we can use to confirm it. Because as you understand, there's a lot of pressure on the homeopath to treat these particularly children. They need to be knowing even the allopathic facts, because, you know, that's what's going around. You know, what you hear on TV, you hear it you read it in the newspapers. So, you know, like I said, the number one trigger, I truly believe, is that it's vaccinations, you know, and many parents call it a man-made disease, which is absolutely untrue. I don't say vaccinations don't play any role, but it's by far not the only particular trigger. So I tried to, because it's, and so when I tried to write a book, which is not easy in a certain sense, that I must make sure that I can have to explain not just everything what's going on, but I can see when I have written this book that many parents will go to homeopath. And I'm a little bit fearful of that, for the simple reason is that to what kind of homeopath are they going to go to? If it's a well-trained one, fine, I will be happy. But if it's not, it's like firing back, right? Homeopathy doesn't work, so to speak. So, I mean, but I try to make sure that the book then also contains many elements for the homeopath itself, that also that parents know what is good homeopathy, what is it, you know, because it's easy for us to say, most parents, as you understand, know nothing about homeopathy. So it's easy for a homeopath to say, well, this is a good sign, even if it isn't, because the homeopath doesn't understand it himself. Oh, it's a curing sign, it's a healing sign. I want to make sure that the parent know if that's true or not. In other words, my goal with this particular book is really more to really get the parents to know homeopathy, an alternative modality that is much more powerful than anything else that I have done so far. And that's what we call the DAN protocol, Defeat Autism Now, the biomedicine, which, by the way, is a lot more of a hinder to us than it is a help, that's for sure. You know, and of course, most patients have already been doing this from the moment they come to you. You know, unfortunately, I would say. So it is important for us to be, even as a homeopath, when you read that particular book that I'm going to write now, it's going to be very good for them to be prepared what they need to do, to see what's happening, to recognize also types of children, to really recognize the triggers that they should pay attention for it, because that's what also going to be in the book, we can say these are the 5 most important emotions that you have to look at it during pregnancy, if they're present. Every medical doctor or anybody therapeutic should be able to look at these things and should really make an investigation as to what. I mean, interesting for me again, I saw so many allopathic studies, is that they really say, like Dr. Vivette Glover, which is from the UK also, she really said it, she was right on with that if we could reduce the stress to these mothers, you know, with 50%, then we would probably save 150,000 children. And then she's right on. But she says, if we could, which means they can't, but we can. Sounds like Obama, but we can.